I'm Dr. Pete Van Branken. I'm a practicing veterinarian in Battle Creek, Michigan. Today we're going to talk a little bit about obesity in dogs. Probably something as veterinarians we see an awful lot of. A lot of people just consider obesity to be kind of an inconvenience for the dog, a lot of weight to kind of carry around. But for veterinarians, it's a lot different deal than that. So what we're going to talk about specifically today is some of the conditions that are exacerbated by obesity. Specifically arthritis, breathing issues, really COPD sometimes with dogs, or collapsing tracheas, difficulty breathing through the larynx, pharynx. So it's one of those sort of things that it's a little deeper than what most people think. First of all, let's just talk about being a veterinarian in Battle Creek, Michigan. We have really cold winters. And so most of our dogs are inside most of the time during the winter, from maybe November until March or April. And so those dogs, when they're inside, they're exercising less, so their caloric needs are less. And a lot of times clients don't figure that out or don't factor that in, that their dog isn't getting that much exercise. So a lot of times, sometimes we suggest people feed their dogs less food, or maybe make an exerted effort to try to get them more exercise, maybe go walking in maybe a dog park or something like that, if the weather's clear enough for them to do that. We think that's a big part of this. You know, it's just like it is with people. Exercise and the amount of calories going in is going to determine how much fat a dog is carrying, or even for that matter, how much fat we're carrying. The thing with the arthritis is lots of times people figure it's just the added weight, you know, the stress on the joints and that sort of thing. And in fact it is, but there's a little more to it than that. Lots of times what you don't think about is that fat, although we think of it as sort of an inert thing, innate thing, it is not. It is a living tissue, and it actually produces a hormone called leptin. And leptin is a protein, inflammatory protein, that causes inflammation. So if I was carrying 30 or 40 pounds more than I'm carrying today, I'd have some problems with the shoulders, my hips, my knees. All those joints would be in sort of a state of chronic inflammation. In other words, you know, even when I'm sleeping, there's some inflammation because all that leptin is being released from my fat cells, adipose cells. So that's one of the things that people probably need to understand, that this really, the fact your dog's going to carry a little extra weight is a lot more serious than what you think it is. As far as the respiratory things are concerned, what we see sometimes when you carry a lot of fat, you'll carry it, you know, it depends where your dog carries it. Most of them carry it reasonably uniformly throughout their body, but there'll have to be some pressure in their neck. And you have what's called a trachea, which is a cartilaginous organ, and at the very bottom it has some elastic. And that elastic, almost like the elastic in underwear, things like that, starts to lose its memory when there's too much pressure on that elastic. So what you'll start to see, those tracheas that are kind of round, and they go up and down a little bit like this when the dog breathes, and all of a sudden there's a lot of pressure on them, so now it's going down further and further and further. And these dogs tend to do, sometimes we refer to as snorking, you know, that sort of thing. And we see that a fair amount. It's also incumbent to know that that pressure on the chest, that's a lot of fat around the chest, is actually going to start to push that chest in a little bit. So some dogs that are having COPD or some lung issues, or even heart issues, will have a harder time breathing because the fat is starting to impinge upon the thoracic cavity, or the cavity in which your heart and lungs are. So we see that at the same time. So I can't tell you how important it is that your dog stays at his or her right weight. That's extremely important, and as veterinarians we spend a lot of time with clients trying to coach them or chastise them, or there's all sorts of ways to get the work done. But the thing that people have to understand is that lots of times these sorts of situations are shortening a dog's life by as many as 2 or 3 years. So when you get a dog that's really, really heavy, those dogs may die 2 or 3 years prior to where they should. We always have a little message for clients. It's like, do you want a dog, or do you want this dog? If you want this dog, we're going to have to get some of the weight off. And that needs to start, you know, on these obese dogs, sometimes around 2 or 3 or 4 years of age. Sometimes by the time we get to 9 or 10 years of age, we've already had too many arthritic changes occur. The trachea has been collapsed. There's not much you can do about that other than get an insert for that trachea, and those things are very expensive. So I think the best thing to do is be proactive as a pet owner. Be proactive and make sure your dog doesn't get too heavy. I think one of the things that some of these dogs like American Eskimos or Shelties, dogs like that, they have a lot of hair on them. I think that you have to get used to running your hand over their ribs. You should be able to feel every rib. 1, 2, 3, 4. 1, 2, 3, 4. And I don't mean by putting a lot of pressure on it. You should be able to just run your hand right over your dog's ribs and feel the ribs. If you can feel the ribs, you're probably in pretty good shape. If you can't, you probably need to figure out how to reduce the caloric intake and increase the exercise, just like they do with people.